All right, my name is Colton Simbeck. I'm a nurse practitioner student. I'll be doing your head and toe assessment today. Throughout this assessment, I'll be touching in different places. Is that okay?
Yes, sir.
Can you tell me your name and date of birth?
Bobby Magnus, 7/17/89.
Okay, so I'm washing my hands.
Okay.
So throughout this assessment, I'm going to be assessing your skin for temperature, turgor, lesions, bruises, edema, texture, and nevi, and things of that nature, okay? So I'm going to be doing a lot of touching, and you've given me permission for that. From starting to look at your scalp, just looking for hair distribution, infestations, any kind of abnormalities or anything like that. So I'm just going to feel, see if you have any kind of lesions, okay? Okay, good. Normal hair distribution, nothing noted. So now I'm just going to kind of look at your head. Head is in midline position, normocephalic, so everything looks good, okay? So now I'm going to feel over your lymph nodes, okay? So you got preauricular, postauricular, tonsillar, submandibular, submental, anterior cervical chain, posterior cervical chain, supraclavicular. Okay, everything looks good. So now I'm going to feel over your masseter bone, over your muscle, your TMJ, see if you got any tenderness there, and your temporal arteries, okay? So now if you will, just open your jaw, close, good, now bite down. Any tenderness there?
No.
Okay, good. And also noted cranial number 5 is intact right there. So I'm also going to check the rest of cranial number 5 of just, I'm going to touch them different places of your face, okay? I want you to close your eyes and tell me where I touch.
Okay.
Good. 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 And so now I'm going to check out your ears, okay? And just I'm going to palpate your pinnae and tragus to tell if you have any tenderness, okay? Any tenderness?
No.
Okay, good. No tenderness noted. So now I'm just going to take a look in your ears, at your ear canal. Okay, good. Pearly gray tympanic membrane. Okay, good. Pearly gray tympanic membrane. So now we're going to test cranial nerve 8, okay? So the first we're going to do is the whisper test. So I'm going to have you cover up each ear and I'm going to whisper some letters and numbers. I want you to tell me what I say, okay? So let's cover up your right ear first.
1, 2, 3.
So now left.
4, 5, 6.
Okay, good. Now we're going to do the Weber and Ryan test, okay? So first is the Weber test. So I'm going to place this tuning fork on your head. I want you to tell me if you hear it in one ear or both ears, okay?
Both ears.
Okay, good. So now we're going to do the Ryan test. I'm going to place it back here on the front, and then we're going to bring it out. I want you to tell me when you stop hearing it here, and then when you stop hearing it here, okay?
Okay. Alright, stop. I said stop.
Okay, good.
All that.
Air conduction is greater than bone conduction.
Stop. Still hear it. And stop.
Okay, good. Air conduction is greater than bone conduction on that as well. So now we're going to check cranial nerves 3, 4, and 6, okay? So I'm going to take a look at your eyes.
Okay.
And so first though, I'm going to just look and see, just look if there's any lesions, have a look at your eyebrow hair distribution, if there's anything abnormally noted, any kind of discharge. So our palpable fissures are evenly spaced. Eyebrows are normally, have normal hair distribution. So now we'll pull down and look at your conjunctiva, okay? So conjunctiva is pink, sclera is white. So now I'm going to take a look at your eyes and do the red light reflex, okay? Okay, good. Positive red light reflex. Okay, good. Positive red light reflex. So now for this, we're going to do the test for cranial nerves 3, 4, and 6, okay? So at first, I'm going to check for pupillary constriction.
Okay.
Okay, good. Direct. Consensual. Okay, good. Direct. Consensual. Okay, good. So now I'm going to have you look at my finger here and follow it into your nose. Okay, good. normal convergence. So now I'm gonna have you look off at the wall here,
Okay.
and then when my finger comes in, I follow it. So
Or not following.
cranial nerve 3, 4, and 6 are intact due to, you see, with accommodation and consensual constriction and direct constriction with light. Okay, so good. So now I'm gonna look in your mouth at your throat. I'm gonna be looking at your gums, your teeth, your uvular eyes, and just like tongue movement and all that. Okay. So when you open your mouth, just say ah. Okay, good. Uvula is midline. Raise your tongue up and down, left and right. Okay, good. So that tells me cranial nerves 9, 10, and 12 are intact. So now I'm going to go ahead and test cranial nerve 11. If you can just raise your shoulders up. Okay, good. So cranial nerve 11 is intact. Now we're going to do cranial nerve 7, okay? So if you can just do after me, so smile,
Smile.
frown, raise your eyebrows, quench your eyes together. Okay, good. Cranial nerve 7 is intact. So now, I'm just going to kind of just feel over your neck, okay? I'm going to feel over your trachea. Trachea is midline. And if you can swallow for me. Okay, good. Thyroid is not enlarged. So I'm going to feel over your carotid pulses. 2 plus. 2 plus. Okay, good. So now I'm going to listen to your carotid artery, okay? Okay, good. Okay, good. No bruits noted. So now if you can just follow after me, we're going to kind of just test the range of motion in your neck. If you can just extend down, flex down, extend up, hyperextend, go left, right. Now we're going to go in circles, circle duck. Okay, good. So all that was normal. And so now I'm just going to kind of look at, we're going to move on to the respiratory part of this exam. So I'm just kind of looking for any use of accessory muscles, any kind of dyspnea, tachypnea, anything like that to show me in respiratory distress. And none of that is noted, okay? So now we're going to test tactile fremitus. So every time you feel me touch on your back, I just want you to say 99, okay?
99. 99. 99. 99.
Okay, good. Tactile fremitus is present. So for this, we're going to move on to agophony. So every time you feel me touch, I want you to say E, 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 okay?
E, 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 E.
Okay, good. So now we're going to move on to bronchophony. So every time you feel me touch, I want you to say 1, 2, 3, or 90. We'll just say 99, okay?
99. 99. 99. 99. 99. 99.
Okay, good. And now we're going to do whisper pictorially. So every time you feel me touch, I want you to just whisper 1, 2, 3, okay?
1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3.
Okay, good. So now I'm just going to percuss your lung fields. You can just kind of turn that way for me just a little bit, like with your feet. Just kind of rotate your, there.
Like that?
Put your feet here on the ground. There you go. And kind of just rotate this way for me. Okay, good. Lung fields are resonant throughout. And so now I'm just going to osculate your lungs, okay? So every time you feel me touch, just take a deep breath. So you can, after you hold your arms out and do your lateral fields. Okay, good. Now if you can just face toward me, we're going to do the tactile fremitus from the front, okay? So every time we touch this, say 99.
99. 99. 99.
Good.
99.
Good. Tactile fremitus is present. So now we're going to move on to the cardiac portion of the exam, okay? So now I'm going to just palpate over every point, okay? And just see if I can feel anything. Okay, good. Aortic, pulmonic, herbs, tricuspid, good. Mitral. Okay, so now I'm going to listen, okay? Aortic, pulmonic, herbs, tricuspid, mitral, and right here would be your PMI. Now listen for 1 minute for rate and rhythm, okay? So we have normal rate, normal rhythm. So now if you can just lay back for me. Let's move over to the opposite side of the bed. So now I'm just looking at your chest to kind of see if I see any heaves or lifts, okay? And then I'm going to palpate for thrills, okay? So I see no heaves and lifts, and I'm going to palpate for thrills. Okay, good. No thrills noted. And I'm going to palpate for your PMI, okay? Okay. Present. So now I'm going to listen, okay?
Okay.
Aortic, pulmonic, herbs, tricuspid, mitral. So now I'm going to flip over my stethoscope. This one to the other side, okay? Okay, good. So at this point, I'm going to lay your head down flat and then put it back on a pillow. We're going to look in for jugular venous distension, okay? Okay, good. So I'm able to see the carotid pulse, and then I'm going to lay you up. Okay, good. So no jugular venous distension noted. So at this point, if you don't mind, just to roll your shirt up, I'm going to take a look at your abdomen. Okay, good. So abdomen, I'm just looking for any kind of abnormal lesions, scarring. Just going to feel the temperature of it, okay? Any previous surgery, so none of that is noted. Abdomen is flat. So if you don't mind, I'm going to listen to your stomach, okay? Okay, good. Bowel sounds are normal, active throughout, okay? So now I'm just going to percuss your abdomen, okay? Okay, good. Tympanic throughout. So now light palpation. Any pain or tenderness?
No.
Okay, good. Deep palpation. And so now I'm going to palpate for your liver and spleen to see if I can feel it, okay? Not palpable. Any tenderness?
No.
Okay, good. Liver not palpable. No spleen is not palpable or tender. And so for now, I'm going to listen to some of your arteries through your stomach, okay?
Okay.
Aorta, renal, iliac, femoral. Okay, good. And of course, in a normal exam, I would not listen to your clothes, okay? Okay. So I'm going to have you sit up, and we're going to move back over to the other side of the bed. Have you sit right here. Okay, so we're going to move on to the musculoskeletal part of this exam, okay? Just going to be examining you for any tenderness, swelling, crepitus, any kind of, deformities, any heat, anything like that, okay? So we're going to start with your shoulders. Any pain?
No.
Elbows?
No.
Move on down to your hands.
No.
Okay, good. So now while we're down here with your hands, we're going to do some serial opposition, okay? So this is going to test for cerebral function. So if you can just do this. Okay, good. Now lay our hands on our lap and flip-flop back and forth. Okay, good. So now we're going to reach out and we're going to touch our fingers together. Okay, good. Now do it with your eyes closed. Okay, good. So now we're going to reach up, extend. Now we're going to, so we're abducting. Now we're going to adduct. Okay, good. Now we're going to go up. We're going to reach behind us. Reach behind with the other hand. Okay, good. Now back this way. Okay, good. Now back this way. Okay, good. So I'm having you grab my fingers. Okay, good. Script strength 5+. And we'll feel your radial pulses. Radial pulses are 2+. So I'm going to have you pull up like you're doing a bicep curl. Okay, good. Strength 5+. Push down like you're doing a tricep. Okay, good. Strength is 5+. So now we're going to push out. Good. 5. Now we're going to pull in. Good. 5. So now we're going to have our hands straight out. We're going to extend. We're going to extend them up. Hyperextend. Flex them down. We're going to adduct and abduct. So we're going to open our fingers up like this and back in. And bring it back in together like this.
Okay.
There you go, good. So now I'm going to see how you feel. I'm going to say sharp or dull. I want you to tell me what you feel, okay?
Sharp.
Okay, good.
Dull. Dull. Sharp. Sharp.
Okay, good. Now I'm going to place an object in your hand. This is called, you're going to take chest for astragonosis, okay? So I want you to tell me what this object is with your eyes closed.
Key.
Okay, good. So now I'm going to trace a letter or number in your hand. This is graphesthesia, okay? I want you to tell me what you what I'm drawing.
1.
Okay, good.
A.
Okay, good. So I'm going to use a tuning fork. I'm going to place vibration over your ulnar aspects of your wrist. I want you to tell me when you feel the vibration and when it goes away, okay?
Feel it.
Okay.
Okay.
Okay, good. Now the other side.
Feel it.
Okay, good.
Okay, stop.
Okay, good. Now I'm going to check your capillary refills. Okay, good. Less than 2 seconds. So also now I'm going to go ahead and do the same thing with vibration on your medium malleus, okay? Do you feel it?
Yeah.
Okay, good.
No.
Okay.
Feel it.
Okay.
No.
Now we're going to test with Binsky, so you can just raise your foot up. Okay, good. Normal. Okay, good. Normal. And so now we're going to move on to your lower extremities, okay? So we're going to be testing the same thing we did up top, just strength, looking for any kind of deformity, crepitus, any bruising, lesions, anything of that nature, okay? So we'll start with your knees. Okay, good. Ankles.
I didn't get that. Could you try again?
Toes. We'll feel your hips. So if you can, just press out against me. Now pull in. So hip strength to 5. If you can push out, good. Now pull in. Knee strength to 5. If you can push up with your feet, dorsiflex up. Plantar flexion down. Okay, good. Now let's abduct. And now adduct. Good. Strength to 5 throughout. So I'm going to do the same thing touching. I want you to tell me if you feel sharp or dull, okay?
Okay.
I know it's going to be kind of hard through your pants.
Sharp. 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 Dull. Sharp. Dull.
Okay, good. Okay, so now if you will, let me have you just stand up. So I'm just checking for curvature of the spine. So we have a normal S. So now we're going to check for scoliosis. If you'll just bend over and put your hands on your knees. Okay, good. Spine is good and straight. Now I'll have you stand up. So now we're going to check the range of motion in our knees. If you'll just walk forward just a little bit. So we're going to go out. Now back in, flex in. Now we're going to hyperextend it back. Okay, good. Now the other side. Out, flex, hyperextend back. Good. So now we're going to put our hands on our hip, chest our hips. So we're going to bend forward. Now back up, hyperextend backwards. Lean to the left. We're going to lean to the right. Okay, good. Now circumduct. Now if you can, follow me. You're going to take your legs. We're going to externally rotate them in. Okay, good. Now the other side. Good. So now we're going to externally rotate out. Externally rotate out the other way. I'll say good, good. So range of motion is excellent through your hips, knees, and ankles, okay? So now if you will, just stand right back here. Have you stand up right here. And we're going to have you walk to that wall. I'm going to say every gait. Okay, normal gait. Now turn around. We're going to tandem walk, heel to toe, back toward me, okay? Okay, good. Awesome. So now we're going to do the Romberg test. I'm going to close your eyes and kind of push you around to see if you fall over, okay? Okay, good. Positive Romberg. So now we're going to hop on one leg. I'm sorry, negative Romberg. So now we're going to hop on one leg. We'll do it right. Now hop on our left. Okay, good. So now that concludes our complete head to toe assessment. Thank you so much, Bobby.
Thank you.